MAPS and our supporters have been advocating for the development and supporting the FDA-approved research of MDMA-assisted therapy for more than 38 years. MAPS will continue working towards safe, legal access to this therapy for the more than 350 million people living with PTSD worldwide. Our collective commitment to MDMA-assisted therapy remains unwavering. MAPS remains fully focused on supporting culturally appropriate research, rigorous science, and drug policy reform that empowers citizen advocacy in all areas of the world, including those with high incidences of trauma and limited resources. Rick Doblin, the founder and president of MAPS.
I'm Dr. Raymond Turpin. I'm the executive director and the clinical director of the Pearl Psychedelic Institute. I was also an investigator and a lead therapist of a treatment team, along with my co-therapist, Kim Skelton, for Lykos' expanded access program, where we treated 4 patients with MDMA-assisted therapy who had been suffering with chronic treatment-resistant PTSD.
I'm Kim Skelton. I am a licensed clinical mental health counselor and a licensed clinical addiction specialist. I've been a therapist for about 20 years. I own a practice in Asheville, North Carolina called Widening Circles. I was privileged to be a co-therapist through the Pearl Psychedelic Institute during the MDMA for PTSD Expanded Access Program.
Our experience in treating the 4 patients we were able to treat with MDMA-assisted therapy was nothing short of profound. We ended up having patients who were a little bit older in age, ranging from about 54 to 72 years old. And they had all had PTSD, chronic treatment-resistant PTSD, for a minimum of about 35 years.
Using MDMA-assisted therapy to treat PTSD was a very profound experience for me as a therapist. Having worked with trauma for most of my career, using EMDR, using many evidence-based practices, being able to sit with people who are able to go this deep, again, has had a very profound impact on me as a therapist, and just seeing the deep capacity for healing that this kind of care can bring, it's just inspired me, to really invest my time and my professional energy, into really trying to bring this new paradigm into the treatment landscape.
One of the things that I was struck with in the Expanded Access Program was the ability for this medicine, in conjunction with supportive psychotherapy, to be able to make rapid gains in their healing process. Gains that I had felt were really impossible with what has been conventional approaches to treating PTSD. These were people that had been suffering for years, in some cases most of their lives. One of our patients had had it since he was 4 years old, which would have been a total of 62 years suffering from PTSD. And these were folks that in many ways had kind of given up on ever getting well. What I saw was that MDMA-assisted therapy, when it was conducted under clinical supervision with the protocols that Lykos handed down, it was very effective in helping these people go in and confront their trauma material in a way that they had been unable to do in conventional therapy. When MDMA goes in and basically shuts down the amygdala, which is the fight or flight or freeze reaction, it allows patients to actually sit with their trauma material as it surfaces, and they're able to do this processing that should have happened at the time of the trauma, but they were unable to do because of the fact that their brains were in survival mode due to the threat from the trauma that they were experiencing. It was profound in the sense that people were able to access this material that they had been shut off from and afraid of for so many years, and they were able to access it and work through it and process it in such a way that they were able to attain levels of healing that had been impossible up to that point in conventional psychotherapy. One of the things we kept hearing from our patients was that this was like 6 years of therapy in 6 hours, or 10 years of therapy in 6 hours. And so I felt like there was an opportunity to be working here with a treatment that's got profound capabilities of being able to accelerate our ability to treat PTSD effectively.
In treating PTSD, there are many ways of treating it that might be called top-down. And then I feel like MDMA is one of these that is more of a bottom-up kind of approach, meaning that it really does allow the integration of body, mind, and spirit, where, more traditional therapies that people might be most accustomed to, we can use our brain and our intellect to try to convince ourselves out of some of these traumatic experiences. But I feel like MDMA really allows people to just sink deep down into their heart and experience a level of compassion for themselves that I just haven't seen with other approaches to this, to treating PTSD.
Well, I think my partner Kim Skelton said it very well, that a lot of conventional talk therapy approaches or the conventional PTSD treatments that we've had, they all take a top-down approach, meaning that we're having to engage the intellect, we're trying to bring in the body, and we're trying to move into the trauma material, which from the nature of PTSD and the way trauma material is stored, it's typically inaccessible. And so what we're trying to do is kind of take a front door approach, going from top down, using the intellect and the body to get to this very deeply held, secretive, fragmented, highly charged material. And it's very difficult to do because in conventional therapy, what happens is you start to develop safety, rapport with your client, and then when you start to move into the actual trauma material, they inevitably find their fight or flight or freeze mechanisms kicking in, and they have a very hard time staying with the material due to the emotional upset and the physiological upset that is really purely involuntary that they're having to deal with at the time, which makes that treatment very difficult to continue in. I've talked to a lot of veterans who have gone to group therapy where it's an exposure model where they're basically in there talking about some of their worst traumatic experiences, and people have left telling me that they felt worse when they left and that they weren't going to go back for any more of that. And so I think MDMA really provides this ability to shut down the amygdala in such a way that this material can be confronted in not such a terrifying way. It also activates the higher order processing and thinking that had gone offline at the time of the trauma. So it allows people again to access this material in such a way that they can work through it and come to some conclusions and some kind of peace around it, which is what we saw. As far as conventional therapy goes, I've been a therapist for a long time. I've been a licensed psychologist for 23 years at this point. One of the techniques that I've used a lot in my practice over the last several decades, since I was taught this intervention in 1995, is EMDR, which stands for Eye Movement Desensitization and Reprocessing. This is a technique that I have found to be probably the most effective conventional technique for treating PTSD. It's an incredible intervention, particularly for things like single incident trauma. But when you start to get into clinical cases that are more of what we call complex PTSD, these are cases that typically we're dealing with a series of traumas during a crucial developmental periods, so that they tend to have the worst, most severe cases of PTSD. I find that most of the top-down approaches, including EMDR, can be a bit like opening up Pandora's box, and it's very common to see patients become overwhelmed when you're trying to go in to do that work using these conventional techniques. One of the things that I noticed with the MDMA-assisted therapy is that we did have a couple of patients that I would say were complex PTSD with severe cases, and what we saw was the mechanism of action in the brain from the MDMA really allowed these patients to go where they had never been able to go before, and they were able to go through and actually process all of this traumatic information that's been improperly stored for decades, and it allowed them to kind of emerge out of this session feeling lighter and feeling at peace, really being able to redefine the relationship of their lives to what happened to them growing up.
While being with patients, participating in this protocol, I feel like it changed me as a therapist, being able to sit with people in their deepest pain and really being able to sit with them being able to be present with things that they just hadn't been able to be present for because of the level of dissociation that trauma can bring. It's just very meaningful for me, as a human, but as a provider, just being able to work with people in a way that feels like it really is facilitating profound healing, rather than only sort of a mitigation of symptoms. It was profound, the work that we did with people. And it was a lot of work, but it was worth it because of the outcome, and to see that level of change within people. It's just very meaningful.
To be in the room with our patients as they were undergoing this therapy was, like Kim said, a profound experience. I developed an incredible degree of admiration for our patients, for their courage in being willing to, after all these therapies and medicines for years had not really helped them get to where they wanted to be able to be willing to take a risk with this experimental technique and to be able to go in and to be able to try to heal themselves. And it was really profound to be able to be in the room and to witness this. We were in the room mainly in a supportive context. We were there to generally facilitate the process. We weren't directing the process in any way, but we were there to provide support. Touching was nothing more than hand-holding if the patient requested it. At times, we would ask patients to do body scans and see if there were any disturbances in their body as they were working through trauma material, because we do know that trauma stores in the body. And if a patient was reporting blockage or pain or anything that felt off in their body, sometimes all we had to do was use a very simple somatic psychology technique, which was providing gentle pressure to that area while they breathed, and it allowed this material to finally move through and seemed to be an important part of the healing process. But for the most part, I think one of the most profound parts of the therapy was to be able to be in there and hold space for these people and witness them going through their healing process in the context of the medicine.
In terms of shifts and changes noted by the folks that we worked with throughout expanded access, I think all of them had previous treatment attempts, and each one of them, independently, not having talked to each other about it, but made the comment that the years of therapy that they had done before now seemed to make more sense, whereas before it felt like something that was sort of swimming out here in the ether.
The FDA request for another study is deeply disappointing, not just for all those who dedicated their lives to this pioneering effort, but principally for the millions of Americans with PTSD, along with their loved ones who have not seen any new treatment options in over 2 decades, said Amy Emerson, Chief Executive Officer of Lykos Therapeutics. While conducting another Phase 3 study would take several years, we still maintain that many of the requests that have been previously discussed with the FDA and raised at the advisory committee meeting can be addressed with existing data, post-approval requirements, or through reference to the scientific literature. Lykos will work diligently in the coming months to address FDA's concerns and to take advantage of agency processes to resolve scientific disagreements. Following the FDA meeting, Lykos expects to provide an update on next steps for the resubmission. Emerson added, "Our heart breaks for the millions of military veterans, first responders, victims of sexual and domestic abuse, and countless others suffering from PTSD who may now face more years without access to new treatment options. We intend to work tirelessly and use all available regulatory pathways to find a reasonable and expeditious path forward for patients who deserve access to methamphetamine-assisted therapy for PTSD." Amy Emerson, Chief Executive Officer of Lykos Therapeutics.
My reaction to FDA's decision on the late afternoon of August 9th, 2024 was profound disappointment, shock in some ways. I was well aware of the criticism that had been leveled at Lykos and the research that had been coming from the ICER report, from the advisory committee. And I know when I speak from our experience as an expanded access team, We found the research to be very well designed, tightly controlled. We were well supervised every step of the way. Lykos came in and did numerous audits to make sure that we were following the protocol and we were documenting everything. We even got to the point where we would be reporting things from patients the day after MDMA, and they would say things like, "I feel so much lighter than I did before." And then we were being told we had to report that as an adverse event, and we could not figure out why something like that would be considered an adverse event. But once we listened to the advisory committee meeting and that they wanted to track positive feelings such as euphoria, which could somehow indicate the potential for abuse, it made sense, and so we understood why we were tracking these things. I do question the fear around MDMA being able to become this highly abused medicine if it were to be approved. MDMA has been around for well over 100 years, and it's been in the consciousness of the world since the mid-'80s. And so I feel like that if MDMA had the ability to ignite some type of epidemic of abuse, that we would have seen that by now.
I think without the MDMA, which, in terms of brain chemistry, allows a person's amygdala to be turned off and they don't experience the fight or flight. And so they're able to have this felt sense of safety in their body while doing this work. To me, that's the most profound thing I have experienced, as a therapist.
I was disappointed in the request for another phase 3 study. I think that's potentially going to take years and cost tens of millions of dollars. This is a research that has been going on for decades. I do happen to know that FDA was working very closely with MAPS PBC, which was what Lykos was before December of this year, of 2023. FDA was working very closely with MAPS and Lykos on all aspects of the study design for probably the last 12 to 15 years. Issues such as safety, issues such as blinding, the study design, these had all been concepts that MAPS was working hand in hand with the FDA on. And so it was profoundly disappointing to hear that basic study design and safety questions were now being called out.
When thinking about the FDA's response, based on my experience as a provider through expanded access, I do feel deeply disappointed. I understand that the FDA has certain ways that they need to do things. While I'm disappointed, I do feel hopeful. This doesn't feel like this is completely taking this offline as an opportunity, as a new paradigm shift. So I still feel hopeful, that this is being delayed. And, as a provider, I certainly want to do whatever I can to cooperate. If that does mean another phase 3 study, then I can be on board with that. I believe in this based on what I have seen, in my own clinical work, and so again, while I'm deeply disappointed because of the number of people in this country that suffer with intractable PTSD, I do still feel hopeful. It's just gonna take longer than we had hoped.
I've been reading the literature throughout this research, going back to the phase 1 studies that were done in the late 90s, and we're keeping up with all the phase 2 and the phase 3 research. And I acknowledge that there was an issue at one site in Canada with therapist misconduct. But I do think it's important to recognize that that was one team out of many over decades of research. They only ended up treating 4 patients at that site. And even when that data of those 4 patients and that team is removed, it doesn't change the outcomes and the statistics of the outcomes. And I think the studies were well designed as psychedelic studies can be. Functional unblinding has always been an issue with any kind of psychoactive component. And so I think MAPS did a good job of trying to blind as well as they could. They actually started early on in the studies using a low dose of MDMA, like 30 to 40 milligrams of MDMA as the active placebo to try to contribute to the blinding. But one of the things they found was that all it did was agitate people. It actually made them feel worse. And so ethically, that didn't seem like a good active placebo to be using, which is why they stopped using it. Functional unblinding has always been an issue with psychedelic studies. Typically, most people will know within an hour or so whether they got the active medicine or not. So that's a problem that's always been around. But again, I felt like this was something that MAPS and Lykos were in dialogue with the FDA about throughout the process, particularly the last decade or so. And so it's very disappointing to hear some of these basic concerns being leveled at the research design at this stage. So what I'm hoping will happen at this point is that FDA will grant Lykos an appeal, that Lykos will have the opportunity to present what they believe is data that's already contained in the phase 3 and 2 studies that have happened, which they feel like can refute or quell some of the concerns about study design and all the other things that are being brought out. But what I'm hoping is what I believe probably, I feel in my heart, should have been the decision, and this would have been the conservative decision based on the data alone. Midomethamphetamine, which is the capsule form of MDMA that Lykos is trying to get approved. I feel like that should have been given conditional approval with the caveat that more research is needing to be done, but not necessarily a phase 3 research where we have to go back and worry about placebos and blinding. We already know enough, I think, at this point that this medicine can be effective in treating PTSD. And so what I'd like is for there to be some conditional approval of midomethamphetamine and that there be a phase 4 study going forward, which is where we can continue to treat people in real time with this medicine and continue to gather data on safety and efficacy, but at the same time getting this treatment out to people that need it and setting it up in such a way that we can continue to learn the best ways to use this medicine safely and responsibly and effectively.
Moving forward, I hope that the dialogue between Lykos and between the FDA can be fruitful. I hope that this will open the doorway to further conversations about what needs to happen. If that means there needs to be a slower rollout, if that means there needs to be a more stringent REMS. For people that don't know what that is, that's a risk evaluation mitigation strategy for new drugs that come to market. I do feel hopeful that we can work together and find a way forward to really support the needs of the millions of people in this country suffering from PTSD on a daily basis.
I think the one thing that I would like the opportunity to speak a bit on is this criticism of the therapy that Lykos was using in conjunction with MDMA-assisted therapy. The criticism that I've been reading are things like, it's not an evidence-based practice, or this is an approach that's unfounded. And I feel like a lot of those opinions are really grounded in probably ignorance about what happened previously in psychedelic therapy. One of the problems with not having evidence-based approaches is that all of these compounds, for the most part, have been Schedule I since the early 70s. So I would say it's been almost next to impossible to actually be doing any research on these compounds over the last 50 years to be able to determine what type of psychotherapy would be evidence-based. With that being the case, we have to go back to a time in American history when psychedelics was being thoroughly researched, and this you have to go back to the late 40s through the early 70s. And when you look back on these studies that were being used with psychedelics, primarily LSD because that's the one that was most used, when you look at the studies that were being used, the treatments for alcoholism, the treatments for cancer, the treatments for depression, the treatments for pain, when you look at all of these treatments, what they found was the most effective evidence-based approach was a non-directive approach, a supportive approach, holding space and facilitating the natural ability of the patient to be able to go in and know where they need to go to heal themselves. There's been a lot of criticism about this idea of inner healing intelligence, as if it's some woo-woo concept, referring to Stanislav Grof as a New Age psychiatrist. He's not a New Age psychiatrist. He was trained old school in Czech Czechoslovakia back in the 50s and 60s, and he came out of psychoanalysis, and then based on his observations from using LSD and psychotherapy, he realized that we have to have a different approach. We have to look at things differently if we're going to effectively learn how to use these compounds to heal people. And one of the things he talked about was that deep down, everybody has this ability to heal themselves. They know what they need to heal. I think it's very easily illustrated in the fact that when you get a cut and you go to the emergency room and the doctor cleans out the wound and sutures the skin, and then the medical team is done. The body takes over healing. And the same thing is with the psyche. The psyche is always pushing towards balance and wholeness. This is also a very old concept. This goes back to Jung from back in the 30s and 40s and 50s, where he felt like the deep psyche was always pushing for balance and wholeness. And this can be seen as evidence when you dream. When we're dreaming, we're processing things that happened to us in the past. We're processing worries and hopes for the future. It's all helping us process so that we get to a place of more balance and psychological wholeness. One of the things we find in our ketamine work is that we're accessing the deep unconscious, and the same dynamics are happening. The information that's coming up, whether it's symbolic or metaphorical, the information that's coming up in these ketamine sessions is evidence that the psyche is offering information in the service of psychological and emotional wholeness and balance. So this idea that we have the ability deep down to kind of know where we need to go to heal is not outlandish, it's not woo-woo, it's not new age. It is grounded in psychedelic science. And so this idea that this non-directive holding space, allowing the patient and the medicine to sort of take the reins and direct the experience, there is tons of evidence for this approach. So I do think that the criticism about the therapeutic approach has been really unfounded.
Again, while I do have some disappointment, I really do feel hopeful after having the experience of sitting with people in a clinical setting and seeing the impact that it has on them individually, that it has on their relationships with people in their lives, that it has on their capacity to regain joy and love, and motivation in life. As a therapist, as a professional of many years, I still very much look forward to this becoming a part of clinical practice, because I do really see how efficacious it can be in helping those among us that are really suffering with PTSD.
The last thing I want to speak to is the need for better interventions for healing the effects of trauma, traumatic stress, and PTSD. I've been a licensed psychologist since 2002, and then I've been in the mental health business since 1989. And I have been using behavioral interventions, talk therapy interventions, somatic interventions, EMDR. I've used a wide range of what I would consider to be conventional therapies. And one of the things that I've learned in my 30+ years of working in mental health is that regardless of the diagnosis, regardless of the mental health issue that you are diagnosed with, if you trace back the beginnings or the etiology of those mental health issues, it almost inevitably leads back to poorly integrated experiences of trauma. And so trauma underlies what I would consider to be probably 80 to 90% of our mental health issues. The organism gets insulted with a trauma at an age, and then what happens is we start to develop compensations for this damage. And the compensations that we develop, whether it is avoidance or acting out or depression, that is what dictates our diagnosis. Our diagnoses are really various compensations for trauma. And so I've figured out about 15 years ago that most everything is trauma-based, and that what we need is an effective treatment for going in and healing the damage that trauma causes. And we've been fairly, I'd say 50% effective at doing that with our conventional methods. I work here in a rural area. I worked in schools for 14 years, and one of the things we always saw was, say, a single parent bringing in their child who had been sexually abused by someone in the community or the woman's boyfriend. And we were able to give the mom really evidence-based techniques for how to help manage their child's behavior, how to help calm them, how to teach them self-soothing, ways to intervene when they find themselves getting overreacted from their trauma. One of the things we kept running into was that the parent themselves had extensive trauma history themselves, and they most likely in this rural area had been unable to access conventional therapies, but a lot of them had had treatment and it hadn't been effective, and they were woefully unable to be able to implement these techniques that we were trying to give them to help their own child. Another issue that I feel like we need to be aware of and address in mental health is this intergenerational transmission of trauma. Meaning that if you have a parent, let's say, that has an extensive trauma history, they haven't been effectively treated, and they're acting out as a result of their PTSD and their trauma, it's going to affect everyone in their family. It's going to affect their kids. It's going to affect their spouse. It's going to affect other family members. And what happens is when I say it affects these other family members, they're going to have these behaviors modeled. They're going to learn that home is not a safe place. They're going to learn that trauma is unexpected and unpredictable. And so what's going to happen is you just end up creating another generation of damaged people who are having to compensate from the effects of trauma. And I think one of the things that I think we need to look at MDMA-assisted therapy for is that based on the data that we got from the phase 2 and the phase 3 research, is there is ample evidence that this intervention has the capability to potentially interrupt the intergenerational transmission of trauma. And I think if we can find something that actually does that, we're going to have a 100-year leap in our ability to treat mental illness in this country.
The third MDMA session that we had with our first participant, the imagery that came from that because of the work that he had done in the previous 2 MDMA sessions, I will never forget that image of, himself standing in the center of all of these different versions of himself at different ages and feeling that they were all hugging him, and to for someone to feel that level of integration when PTSD, it fragments a person's psyche, and so to sit with someone and for them to feel that sense of self-love and acceptance, I will never forget that image.
One of the stories that I would like to share very briefly from our expanded access work, with our patient's permission, he was given that, was our first patient that we treated was a veteran, and his main index trauma occurred in basic training. It happened the day after the Loma Prieta earthquake, which occurred in the Bay Area in California in October of 1989. And he had been sitting on a wall, beside a wall, with one of his buddies, and the wall collapsed on top of him. Our patient could not move and get to his friend. He could hear his friend struggling, and they ended up carrying off this person, and he never found out whether they lived or died. But he had been plagued with nightmares for decades afterwards. When he came in and did his MDMA work, after the first MDMA session, his nightmares stopped. When we completed his treatment, at the end, he contacted Kim and I and said that he really wanted to thank us for the profound change that we had been able to help him with in his life. He said that he had been trying to think about ways to express his gratitude for the changes that he had undergone as a result of this therapy. What he did was he said he was trying to think about a way to thank us, and then he said it hit him like a bolt out of the clear blue sky. And he went straight to a locked metal box that had been locked since October 1989, that he had been unable to bring himself to even open. And he said he went straight to that box, opened it up, and what was in there was he pulled out his uniform that he had been wearing that day when the wall came down. And he put together this picture box for us that's the scrap of his uniform, still has the mud on it from that day. And there's a saying on there, "Peace of mind is the softest pillow." And this was a statement that his father would make growing up. And his father played a large role in the MDMA-assisted therapy and the healing as well. And so this was a profound symbol of the level of healing that this one patient was able to attain as a result of MDMA-assisted therapy.
For now, it is essential to make our voices and determination heard and felt. Obtaining prescriptive availability of MDMA is a necessary and vital part of bringing MDMA into the light. From all of us who know its value, safety, healing, and its tendency to evoke kindness, tolerance, compassion, and sharing, the FDA must reverse its mandate and let us move on. Phil Wolfson, MD.
We are encouraging people to educate themselves about this treatment. So in addition to the quotes we've shared in this video, we've included some links to the full articles, as well as links to other supportive articles in the description. Thank you for watching, and please remember to like this video and to subscribe to our channel. And we'd love to hear your thoughts, so please leave a comment below. And for more information, questions, or to make a donation, please visit us at pearlpsychedelicinstitute.org. Thank you.